Hello, the topic I have chosen for the modified diets or sodium restricted diet. As we all know, salt or sodium chloride is found in convenience and preserved foods. The foods that do not spoil easily are usually high in sodium. Following a low sodium diet can be challenging, but remember that there are no foods that you cannot eat on your diet, but what is important is the amount of foods you eat and how often you cut them down. So let's begin with the pros and cons of sodium. So what a sodium is. So sodium is an essential mineral which is found in almost all foods that we eat. It helps to maintain fluid balance in our body, and it's also important to regulate the acid-base balance. But the more sodium is consumed in your diet, there are certain cons that is involved, like there might be a high blood pressure, and increased sodium may also lead to buildup of fluid in people with congestive heart failure, cirrhosis of liver, or kidney disease. So what is the purpose of sodium restricted diet? The main purpose is to manage hypertension in people who are sensitive to sodium. And there is also an important reason to controlling sodium in the diet for those people like who have edema or ascites. So for them, to promote the loss of excess body fluids, there is a need to restrict sodium in their diet. And sodium restriction can be of different varying degree. Like sometimes the RD, registered dietitian, or a doctor can prescribe a patient like 2 grams of sodium or 5 grams of sodium per day, or even lower. So you don't really know how much the patient needs until you do a thorough investigation on that patient and the physiological needs, based on his physiological needs, and then you can monitor how much sodium he needs, whether he's a dialysis patient, whether he's a patient with hypertension or ascites or edema. Depending upon the individual needs, the sodium is restricted. Now, there are varied conditions for the prescription of sodium in different patients. The restriction can be for management of essential hypertension, or it can be for cardiovascular diseases, or maybe the person is in a cardiac failure, or he or she may have an impaired liver function or renal diseases, or he may also have a chronic renal failure. So these are the conditions where usually a low sodium diet is prescribed. So what is a dietary considerations for people with sodium restricted diet? So they can eat varieties of foods. Specifically, they can consume a balanced diet. And if the fresh and frozen vegetables are equally good and they are all low in sodium, so the first choice you can give to your patient is to ask them to eat plenty of fruits and vegetables, because unless they are not patients with renal issues, renal problems, because you have to restrict potassium. So fruits and vegetables are rich in potassium. So But if not, if they are just patients with ascites, edema, or hypertension, you just want to restrict sodium, then you can tell them to have a lot of fruits and vegetables in their diet because it's very much low in sodium. And also they can also have plenty of fresh and frozen meats, chicken, turkey, and fish. But just make sure they don't have canned foods, because canned foods are high in sodium. As we know that usually preservatives are added. Preservatives contain sodium in them. So just make sure they don't have canned food in their diet. And what are the food that we need to avoid for the patients on a low sodium diet? So make sure like they don't have processed or prepared foods. Usually all the processed foods, they, even if it is like a sweetened food, if it's a cake, pastries and everything, they also have sodium. So make sure they don't have that. And also the beverages, and ask them to read the label before they buy any beverages. So see the sodium content in it and make sure they don't have it. They don't have the beverages that have sodium in them. And also just make sure like they have just like half a teaspoon of sodium, like it's 2 grams, so half a teaspoon per day. So no extra salt at the table or cooking. And most of the dairy products like milk, cheese, butter, everything has sodium, high content of sodium. So make sure they restrict it to 16 ounce. And just make sure whatever commercially prepared products they buy, make sure that it doesn't have salt, no salt in them. Yes, it's a very challenging situation for the patients with a low sodium diet, but you make sure that you convince them, tell them the consequences of having too much of salt in their diet, the sodium in their diet. So explain to them and tell them like they have a salt shaker at the table, and don't just cook without salt, like the surrogate or a caretaker, whoever cooks for the patient, or the patient himself or herself, if she cooks, just make he or she cooks the meal, just make sure they know about this, that they know salt is added while cooking. And they have to experiment with low or no salt herbs, spices, and seasoning mixes. And they may also use seasonings like black cayenne or lemon pepper, dried and fresh herbs like garlic, onion powder, parsley, rosemary. I mean, they can, all these are naturally, they are low in sodium, so you can encourage them to use it for cooking. And it's always better they substitute salt with lemon juice. Like if they want to have, the salty feel, you can ask them to squeeze lemon in any food they make, any meals they prepare. You just ask them to sprinkle lemon juice on them, so this way they have the feel of salt, but they're not actually consuming salt or sodium in the meals. And just make sure they avoid the spices and seasoning mixes with the word salt or sodium in the name. Like for example, like sodium benzoate, which is a preservative. So anything which has a name sodium, just make sure they avoid it. And usually you have to see the patient's point of view also. That is, whether look at their financial limitation and the socio-economic conditions, whether they are unemployed or illiterate, or they are in a depressed situation, or they have an access to the healthcare facilities, and their culture, background, everything into consideration, while explaining them the need to restrict their sodium, and explain to them like how they can, if just make sure they eat. If they are not in a low socioeconomic condition, they cannot go to the supermarkets You can tell them to buy fruits, fresh fruits and vegetables which are locally grown, which are considerably low in sodium. So this way you can help them get the food that they need, which is low in sodium, and also explain to them if they are not much literate, they're not that much educated. You can explain to them the foods that are low in sodium and what not to buy, what to buy, you know. So make sure they understand what they are consuming. So yeah, and these are the references that I made for this talk, for the topic I've chosen. So yeah, so you can always ask any questions regarding this in our discussion forum. Like, you can, after you listen to this lecture, you can get back to me in the discussion forum and ask me any questions regarding this lecture. Thank you.